Today I'm going to talk about 30 evidence-based points on sexual health and understanding among adolescents and young adults in Bharat. It will be a guide to all gynecologists who are watching this particular video. As you all know that the World Sexual Health Day is September 4th. Sexual health is a fundamental right. WHO defines sexual health as a state of physical, emotional, mental, and social well-being in relation to sexuality. It is essential for overall health and the quality of life. We all know that the early onset of puberty is taking place in India, and this in turn leads to sexual curiosity. The average age of puberty onset in Indian girls has dropped to 10.5. 70 years back, it was 13.5. Increasing sexual curiosity and the need for early sexual education. Knowledge gaps in sexual and reproductive health are far too many. Over 60% of Indian adolescents lack comprehensive knowledge of menstruation, contraception, and sexually transmitted infections before their first sexual encounter. So awareness is needed among adolescents. As for the role of gynecologists in sex education is concerned, gynecologists must act as trusted educators, as only 30% of adolescents receive accurate sexual health information from school or parents. Adolescent sexual activity and the risk factors. Studies in India have suggested that 15 to 20% of adolescents in urban areas are sexually active, which many engaging in unprotected intercourse due to lack of awareness of contraceptive. There are many myths and misconceptions in adolescence. Common misconceptions include that the first time sex cannot cause pregnancy. Ridiculous. The second misconception is that contraceptives cause infertility, leading to risky behavior. So these myths and misconceptions have to be taken away from their mind. Increasing prevalence of STI in young adults. 40% of the new STI cases in India occur in individuals aged 15 to 24 years. With regard to HPV infection, chlamydia infection, and gonorrhea infection being the most common. This fact must be known and conveyed to all adolescent and young adults. HPV and cervical cancer vaccination. 80% of sexually active women during adolescence will acquire HPV at some point. So HPV vaccination at 9 to 14 years is crucial for primary prevention of cervical cancer and other HPV-related cancers and diseases. The HPV infection in our Indian population varies from 6.5 to 8%. It means colossal number, and that's why all adolescents must be given vaccination, HPV vaccination, right from 9 to 15 years. Now the government of India says that even the boys can be given vaccination, and indigenous vaccines are available like Sarvavac, which can be given from 9 to 26 years. It is a gender-neutral vaccine. Contraceptive awareness and the use is seen in only 10% of adolescent girls in India. They use modern contraceptive, leading to high rate of unplanned pregnancies and unsafe abortions. So again, awareness is needed. Emergency contraceptive myths are again, there many adolescents believe emergency contraceptives cause permanent infertility. Again, हंसने वाली बात है. It leads to reluctance in its use after unprotected sex. There are unmet needs of contraception in adolescents. Among 15 to 19 years old married women is 22%, reflecting gap in access and awareness. Unsafe abortions and their consequences are also far too many. 50% abortions in India are unsafe, with significant number performed on young girls by unqualified practitioners, leading to maternal mortality and morbidity in this group. Sexual violence and coercion is there, zabardasti. 1 in 3 adolescent girls experience some form of sexual violence, leading to long-term psychological and reproductive health consequences. Digital influence on adolescent sexual behavior. Easy access to pornography without proper sex education influences unrealistic expectations and unhealthy sexual behaviors in this vulnerable group. Mental health and sexual well-being. Poor sexual health literacy contributes to anxiety, depression, and body image issues among adolescents. And again, they can be rectified by life sciences workshop for each and every adolescent. LGBTQ, adolescents and inclusive care. 10 to 12% of Indian youth identify as LGBTQ, yet lack of access to non-judgmental sexual health services leads to increased mental health issues. We are not thinking at all in this particular area. Both gynecologists and pediatricians should come together and address this particular need of adolescents. Period shame and hygiene. Nearly 25% of adolescent girls drop out of school due to menstruation-related stigma and lack of proper menstrual hygiene facilities. The time has come that each and every menstruating girl should be given clean sanitary napkins, which are available for 1 rupee in Pradhan Mantri Yojana. And I think, every girl child has a right to use clean pads. We must teach them about proper menstrual hygiene as well. Sexual dysfunction in young adults. Cases of vaginismus and erectile dysfunctions are rising in young adults due to performance anxiety, pornography-induced expectations, sexual ignorance, and even sexual violence. Role of gynecologists in counseling. Adolescents prefer private, non-judgmental counseling on sexual health, emphasizing the need for gynecologists to create a safe space. Polycystic ovarian disease, obesity, and sexual health. 40% of the young Indian women with polycystic ovarian syndrome experience sexual dysfunction due to obesity, insulin resistance, and hormonal imbalance. Impact of mobile and social media on sexual health perception is too much. 60% of young Indians obtain sexual health information from unverified online sources, leading to misinformation. I just want to quote one incident. This boy is from Orissa who has topped in IIT preliminaries. He's got 300 marks out of 300. When he was asked to give a tip to all adolescents about how the preparation need to be done, and he said only one thing: पढ़ते तो सभी हैं, पर ये जो बीमारी है फोन की, ये खत्म होनी चाहिए. किसी adolescent and young people के पास फोन नहीं होना चाहिए. अगर फोन नहीं होगा तो डिस्ट्रैक्शन नहीं होगा, तो आपकी सारी एनर्जी आप कंसंट्रेट करोगे एक अपने काम पे. यंग पीपल को पढ़ना है और इकोनॉमिकली इंडिपेंडेंट बनना है, देश के लिए काम करना है. मेडिकलाइजेशन ऑफ वर्जिनिटी, द हाइमन मिथ. Hymenoplasty request increasing due to cultural stigma कि जो लड़की वर्जिन है उसकी हाइमन होनी चाहिए. ये सरासर साइंटिफिक एविडेंस नहीं है. Despite of the scientific evidence that the virginity cannot be determined by the hymenal status, but क्योंकि मान्यता है, इसलिए जो लोग प्रीमैरिटल सेक्स में इंडल्ज करते हैं वो हाइमेनोप्लास्टी की उनकी रिक्वेस्ट बढ़ती जा रही है. Substance abuse and risky sexual behavior. Alcohol and drug use in urban college students is increasing, is a cause of concern. It correlates with increasing risk-taking in sexual activity and higher STI rates multiple partner relationship. Parental hesitation in discussing sexuality. Only 5% of Indian parents discuss sexual education openly, leaving adolescents to rely on peers and social media. Male sexual health neglect. Discussion on sexual health in India disproportionately focuses on females, ignoring young males' reproductive health needs. The role of schools in comprehensive sexual education is very important. Less than 10% of the Indian schools offer structured sexual education, making it essential for gynecologists and pediatricians to advocate for policy changes. Rise in sexual identity confusion. Exposure to global sexual norms versus conservative Indian values leads to identity confusion and distress in adolescents. Sexually explicit content in India. Increasing sexual content in Indian movies, in web series, shapes adolescent perceptions tremendously. They are without guidance, they do not consult what is the evidence, and this can promote unsafe sexual behavior. Medical training deficiencies in adolescent sexual health. Most gynecologists do not receive structured training themselves in adolescent sexual health, making it continuous education for themselves an essential before they can impart education to the adolescents. The need for youth-friendly services. Adolescents need accessible, confidential, and stigma-free reproductive health services, which gynecologists and pediatricians must actively promote. Call to action for gynecologists and for the doctor community in this particular country is advocate for comprehensive sexuality education in schools, give life skill workshop for each adolescent, provide non-judgmental, youth-friendly consultations, raise awareness on safe contraception, HPV vaccination and STIs, engage in digital platforms to counter misinformation, and train in adolescent psychology and LGBTQ plus health for inclusive care. Call for action for gynecologists is by addressing these issues proactively. The gynecologists can bridge the gap in sexual health education, reduce adolescent reproductive health risk, and create a healthier future for young Indians. Thank you very much.